And then the last thing, which is kind of your wheelhouse, Troy, is exercise training. So kind of using like a graded exposure model. If you're not able to do this, let's get you to this point, but gradually and work through it over time. Obviously, symptoms can happen. Fatigue is very likely. And so the biggest thing is like making sure you have like a trainer, or if your symptoms aren't that bad, you're just very aware and know how to take care of these symptoms as they come up and can recognize it, and that you're just making increment improvement throughout trying to increase blood flow and regulation and tissue perfusion. So exercise is great.
Yeah, and this is a conversation I've had with Brittany as well, with exactly that question, exercise considerations for POTS patients, and the people that we've seen so far together in at Parker Performance Institute, with kind of partnering with each other on the patients and patient care, is introducing exercise with kind of a low level isometric for the lower extremity, and pairing that with other symptom modification strategies like kind of like we talked just before we clicked record on the call today about, like parasympathetic upregulating, sympathetic downregulating strategies like RPSS. And we have a tool called the ResiMax. You can literally put it on your neck, and the RPSS can be applied to different areas as well. But the thought process is to upregulate that parasympathetic and downregulate sympathetic drive, just to help the system kind of be a little bit more calm, and try to reduce those adverse effects that exercise may have in those patients in those contexts, to kind of layer those together in a way.
Yeah,
And
that's neat.
the thought process with the isometric is actually to get that muscular contraction around venous structures, and the thought process is to shuttle the blood a little bit more effectively and back to the heart, and therefore increase the stroke volume and cardiac output to increase the perfusion. So same idea probably with the compression garments that you were mentioning too, but it's a way to also introduce exercise and that graded exposure model. And another thing I was reading from an exercise standpoint, and it was just a paper before our conversation today, was again, to tolerance, once symptoms are kind of under control and within tolerance, just a slow bike 5-minute session, if symptoms increase, like conclude the session, but try to shoot for just a few minutes, and then, take a day or two off, go at it again, same time frame, and then just keep tabs on what the symptoms are doing during and after the session, and slowly just increasing the duration of the bout of cardiovascular exercise, because it is something that is huge for POTS cases and has great outcomes. I mean, cardiovascular exercise is great for anybody, but when it comes to increasing that capacity for the cardiovascular system, and actually getting that constriction too in the periphery, and actually shuttling the blood and increasing the perfusion and increasing stroke volume, that is going to be huge for those cases to decrease the symptoms of syncope, presyncope, and regulating the heart rate as well. There's also exercise intolerance with POTS cases, so you got to be sure they're ready to slowly introduce that exercise regimen. So there's other conservative strategies that you just talked about with the drinking of water and the salt intake and conversation about medication too. Of course, like you mentioned, that is not a Cairo conversation. It is good to take note of and then work with another provider, because we can't give recommendations on anything like that, but it's definitely good to be aware of. Even with medications that they're on,